Hot, 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 hot.
Hot, 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 hot.
Starting preview. So why don't we talk to our viewers? Hey, welcome to the show. This is the Auburn Medical Group, and we are live, which means you can ask us questions of ourselves, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Yes.
And you can do it two ways. One way is through the chat function on YouTube, which this is YouTube Live, so if people are catching it while we're doing it, you can chat right there on your device. And also, patrons that know the secret ID for Dr. Vaughn, this Dr. Vaughn,
Yep.
then you can actually write in, or I'm sorry, call in.
Call in,
Call in, voice call. We've got, we're ready. Operator, me, is standing by.
Yeah,
So,
you're the operator.
I am the operator. And
No
I am
phone tree here. You get a real live body.
You can get right in, so just barely.
So let's see here. Just Me says, where are all the earwax videos? And Bianca Dye says hi.
So we certainly can talk about earwax videos because that's kind of a little specialty that we've had in the past.
It is, yeah. We do a lot of
And
those.
I feel like we've done a good job with it. We've had some better than others, of course, but we've had some amazing earwax videos. And I'll tell you what happened. There is a cost to doing this. It is something more than just having a camera we already have and a procedure that we're already doing and filming it. In order to be able to make a video out of it that works, you have to have another person there holding the camera. You have to take some time doing it, set things up, and that makes things slow down in a, I don't want to say busy doctor's office because we're about as relaxed a schedule as you'll ever find, but there is a certain cost in personnel and time in a doctor's office to make that happen. And it worked out great. YouTube had advertisements and it worked that we were getting enough revenue from that, you know, we could kind of look at it and say, it's okay to do that. It's not too much of a drain. But once YouTube decided that any earwax removal videos are not advertiser friendly and pulled all the ads, then that's pretty much when they almost stopped completely. I mean, there's been one or two since then.
Yep.
So if YouTube would feel comfortable having a video with earwax coming out of somebody's ear and putting an ad on that, then we'd probably be seeing more of them.
Probably.
So,
yeah. So write your congressman. I mean, write YouTube and protest.
I guess so. So that's the story on why there's not as many earwax videos. And we do these videos, even though we don't get huge hits for them. You know, there's probably not any revenue to speak of really, but we go ahead and take out just because we enjoy doing it. It's kind of like the blog. Right. It's worth doing. And we do have patrons that help to make up for it. So, and those are the ones who can call in on Skype. So if you're one of them, you can actually call in right now and we'll take your call on the show. Yeah, and we are doing questions. It looks like we have a lot of people who are...
We've got a few, yeah. Hello to all. Bianca Dye, Brianna Nagel, Brio.
Brio. So those are familiar names from past episodes.
Anacito.
Hola. Hey. Hola, Anacito.
Yeah. Let's see here. Bianca Dye says she's having some tests for lymphoma. What symptoms do you worry about with lymphoma?
Wow. Weight loss.
Yeah, that's probably the biggest one. Weight loss. Any cancerous process.
Swollen lymph nodes. If it happens to be lymph nodes, we can
somewhere
fine. You know, if it's inside the middle of your chest or your abdomen, you may not even appreciate
those are areas
that they are there. Unfortunately.
Yes.
Yeah.
Sometimes
so we hope it
fevers.
Isn't. We hope it is not.
Fatigue. They're kind of just general symptoms. Not anything big.
I have something in my back. What is it?
What is going on?
Oh, I know what it is.
It's your other ear.
It's the
other earpiece.
My secret earpiece that they can't see.
Lymphoma. It's. I guess the question is: first, do you have a swollen lymph node? Is that why they're worried about it? Right. And from there are certain criteria for whether or not we get concerned about whether or not we should, get a biopsy for lymphoma. Most often is like people come in with these lymph nodes in their neck and they're like, oh, should
really
I be worried about this?
It.
It's been there for such and such a time. Most of the time, I can tell you, it's not worrisome. There are some parameters that we have as far as time and. Now, if you're sick, if you have a upper respiratory infection or even flu, anything like that, that can obviously give you some swollen glands. Strep throat's a common one. And that's a good reason to have swollen lymph nodes. That means the lymph nodes are doing their job. The lymph nodes are essentially the infection-fighting areas in your body, so they'll kind of bring in the infection and bring in all these white blood cells and fight the infection and make the antibodies that can then go and get rid of the infection. So that's why the lymph nodes swell up. There's a battle going on in there.
So is this Bianca dye?
So yeah.
Okay.
Yeah,
Bianca.
yeah.
We'll be praying for you.
Yeah, that can always be worrisome or concerning, at least when you're having those tests done, and it can be very stressful. We'll keep
especially when you're waiting and waiting.
Yeah, because that can take some time too. My X-ray was clear. Bianca Dye says that's always good.
Okay.
I would imagine it's a CAT scan. Maybe a CAT.
X-ray is not really gonna.
Yeah, not gonna show you a lot. A CAT scan,
really...
we can see the lymph nodes a little better.
Yeah.
Some. Let's see.
He's looking for
Petra Russell. Hi. Let's see.
Petra
What do you?
Rosenberg?
I haven't heard from her in a while.
Is it a different Petra?
It's a different Petra. Petra Russell.
Oh, okay.
Even with an R last name.
But Petra Rosenberg's last I saw on Facebook is still having a lot of
going through treatment for
cancer treatment. Yeah.
Cancer.
In Sweden.
Sweden's where she was at.
Yeah.
Yes. Little shout out. Put up a new blog this morning. I'm releasing this series. I consider myself a spiritual guy. I do believe in a higher power. So I'm doing this intermittent series on prayers, like a scientist's prayer book. There are things we learn as scientists that just amaze me, and I just want to, in my opinion, put credit where credit's due and thank God for those things. So it's actually. I enjoy it. I'm trying. You'll see a pattern if you've seen the 3 that I've done. I'm actually trying to go through the alphabet with each of those, trying to find a scientific thing for each thing. So A was ATP.
An acrostic.
B was the brain, and C is cells. So we'll see what D is. D is actually DNA. Spoiler alert.
We know. He told us.
Hey, you guys learn it first. So
okay.
It's been fun.
Okay.
It's nice to think about those small things again. Some of them is going back to basic biology, like cells.
I noticed that. That's why I was thinking
like about
basic things.
The nucleus, and I haven't used the word Golgi apparatus in
Golgi
forever.
Apparatus.
So I did. I thank God for my Golgi apparatus.
Okay, that makes like lysosomal things for packaging proteins.
Impressive. Yeah, it does.
Right?
It has some other things too. I mean, that's the basic function though.
It's similar to smooth ribosomes.
Yeah, so endoplasmic reticulum is probably what you're thinking about. Ribosomes are on top of the...
Or on the rough endoplasmic
On the rough
reticulum.
endoplasmic, and they're the ones that do the translation of mRNA.
Can you see how long it's been?
I probably would have sounded like this, but I just didn't. I just looked it all up again.
Biology cellular biology, cell bio, molecular biology, all of that, which is amazing stuff because it's where we find out that biology science, which we think of as memorizing the names of class and phylum and species.
I hated that.
Of animals.
Kingdom, phylum, class,
the
genus,
taxonomy.
species.
But it's also, you get down, start looking at the smaller level of what makes up these biologic organisms, and it's biochemistry.
Yeah.
It all is. The whole thing.
Molecules.
Is chemistry. And then chemistry, you take that down to the more basic levels and you find out it's all physics.
Yeah, I know.
And you take that down to the basic level, you find it's all mathematics.
Interconnected. Pretty amazing.
Yeah.
So check it out. I enjoy it.
Thanks.
And like I said, hopefully I'll eventually make it through the whole...
So G is going to be Golgi apparatus?
Well, I don't know if I could get a whole prayer in on the Golgi apparatus. We'll just package that in with cells for now.
Package, nice. That was good.
Yep.
Those of you that know what the Golgi apparatus does. Okay.
Oh, we got some comments here. Somebody has a plugged ear. How do they take care of That's Petra Russell.
As long as the eardrum is intact and you don't know that.
Yeah, it's tough if you don't have a
Well, you might know if you actually don't have an intact eardrum, you don't want to be putting water in there. But when the eardrum's intact, we're very comfortable with squirting water in. I say squirting, that sounds like a horrible word, but essentially that's what it is. Careful to control the pressure so as to not rupture the eardrum. And so over-the-counter bulb syringes generally are okay to use if you know that your eardrum's intact. That's the thing, though. How do you know that? Well, getting it looked at. Well, how do you know if it's intact if it's completely blocked with wax? You don't. And so sometimes we'll go in with ear curettes, like those made by Bionics.
That's right.
Or Bionics. I need to ask them how to pronounce it. Anyway, the reason I say the name of the company is because I've had conversations with this company. I don't know if it'll turn into anything because I only sell stuff to doctors, and doctors don't watch my show, so I don't think it'll turn into anything. But I like their product anyway, even if they aren't doing anything more than just giving me a couple a month or whatever. Yeah. I think we got some new ones. The lighted.
Those ones are pretty neat.
The lighted curette. That
those are neat. It's kind of like a
by
little
that company. Yeah. And I told them that their Earwax,
lightsaber.
remember the washer with the water pick? I told them that people complain about how loud it is and that they wince when it goes on, even on the lower setting.
It works
so
well, though.
The company has been told, because a lot of you wrote that in the comments.
Yeah.
It looks painful.
Yeah.
Yeah, they've heard.
Yes, they know.
And
ours leaks now. Anyways.
It does. I told them that too.
Yeah.
I did.
All right.
Yeah. They are hearing these things. So commenting on our videos does get back to the company.
Let's see here. So, what else? Oh, knee replacement. Bria's on her 34th operation for knee replacements.
What?
And infection. That is a lot.
Oh,
wow. I'm curious. Knee replacements. I'm curious how many of those were actually replacements and how many of those were actually treating the infection, like a IND or washout or. I don't know. That is. I'm sorry about that. That is.
Wow.
That's horrible. I hope that at the 34th operation that they've figured it out, and hopefully you are getting better.
I've not heard of a case.
Could be limb loss or sepsis. Oh my goodness. Next for patellar tendon reconstruction. Oh my goodness. That is a lot.
So do they just take the hardware out?
Yeah. Yeah, I've seen them do that and then just
fuse
it and make it a big, long, straight, lose your joint essentially.
We do have a patient
That's right.
My patient has a fused knee, and her leg is always sticking straight out because it's fused.
Yeah, golly.
Yeah. Which it looks like it'd be uncomfortable because it has the appearance of the person holding their leg in extension, but no, that's not the case. It's fused.
That's her relaxed state.
That's the relaxed state. It's straight. It doesn't.
Yeah, she sits down and her leg's just sitting there. It's kind of, it looks like it. Yeah, it looks like it'd be uncomfortable. Yeah. Still no callers, huh? Gosh.
Well, let me check and see if the Skype is plugged in and
make sure that's working.
You
too can be a Skype caller.
But only
if you could
we are open
become
for
a
business
patron.
Here.
So while we're at it, I'd like to thank some of the patrons of my blog, Boo Boo Kitty. Thank you very much. And also, Boo Boo Kitty, I don't see you watching this right now, but at your level, at the level that you're supporting, you do get to suggest a blog post once a month. So. You sneeze. So give me.
They don't want to sneeze on our audience.
Good. Yes. All right.
It's not 3D. Never mind.
Not 3D.
Don't worry.
Yeah. What's that Disney ride where they like throw water on you when the thing sneezes? Oh, that was like the Honey I Shrunk the Audience one.
Yes.
Do you remember that?
Is it in a dog that sneezes?
Yeah. I think it's a dog that sneezes on you. Anyways, so Boo Boo Kitty, let me know.
Sorry.
Let me know what post
or
what idea or give me a list and I'll choose some for you.
Okay. So and I also need to thank Lindsay Antwine.
Yes.
And also Boo Boo Kitty.
Here, I'll let you answer that one.
Okay, I'm reading. This comes from Petra Russell. Sometimes people will have.
If you're watching it in playback, read it.
Oh yeah, they can read that. So sometimes people actually have breast reduction surgery.
Yeah,
to help with that. Now I love that some people don't know what the question was.
That's awesome.
And we have had patients,
leave it like that.
Specifically for low back pain, have reduction, and it works.
It does work.
It does help.
That's a lot of
it depends
anterior weight, let's say.
Yeah.
That can a lot of stress on the lower back. Let's see here. Try to find something else. Somebody was talking about lower back. A spinal cord stimulator.
Okay.
Have you ever had any experience with those or sent anybody for one of those?
Yeah, we've sent patients for those, and yes, we get good results. We have patients who are able to cut down on, some of those people who are on chronic opiates for their back pain from back when we used that, They are able to use less of the opiate medication with the stimulator.
Right. Yeah, it's amazing how they work.
Yeah, and the electrical stimulation, the TENS unit, transdermal electrical.
Yeah, that's on the outside.
Nerve stimulation. Yeah, right. Same thing's going on, but it's going to the muscles instead of to the nerve. Those are being used by the orthopedic surgeons. They're actually now advising me to have patients buy this over-the-counter. I guess there's one at Walmart.
Wow, that's excellent.
For people who before they would have just thrown Vicodin at, now they're using electrical stim, and they say, yeah, they can wear it all night. You know, you have it on the low setting.
Excellent. Way better.
You can adjust the setting. Always start
opiate
low
medications,
with TENS.
of course.
Yeah.
Yeah.
So there are some options there for different pains.
Yeah.
Because what we're doing whenever we're treating pain with most modalities, I won't say all, is trying to do something to the nerve. So you've got a nerve that's transmitting a message, and this is a pain fiber that's transmitting the message. Now, if we can do something like block the transmission with an opiate, or if we can get rid of whatever's starting the transmission, if it's a chemical mediator with an anti-inflammatory, or if we can affect the brain where this signal's being interpreted, which, is that where acetaminophen works? And do opiates work there too?
In the brain, yeah. Opiates work on the mute receptors in the brain to block.
Thalamus?
No.
Anyway,
it's lower. Yeah.
We're getting a little too in the weeds here.
Well, yeah.
But another thing is, if you can use an electrical stimulator to modify what's going on in the nerve, it may not be felt as pain.
Yeah. Barrio says that hasn't worked for her, but Bianca
okay.
Dye says if she takes her TENS, she uses less tramadol.
There you go.
So worked for one out of two. That's our small sample size.
That was Bianca Dye.
Bianca Dye, yeah.
So Bianca...
I don't know if she was the one that had the question.
Is an example of exactly what I just said.
Yeah.
Thank you, Bianca. That's good to hear.
Yeah. So it helps. So these electrical nerve stimulators that are actually implanted into the spinal cord are...
Yeah, we don't do those.
Yeah, we don't do those here. That's done by a pain management specialist. But it's pretty amazing. They have this, and it's minimally invasive. They essentially do it through like an epidural needle, essentially. They have this thing rolled up really, really, really small, and they place it up, and it kind of comes in and unfolds.
They do roll it, but they don't twist the ends.
Right, yeah, they don't. It's not like a piece of candy. But it unfolds, and it's this almost like a checkerboard network of all these different areas where they can turn it on and off. And actually, while you're sitting there on the table, they can do all these different changes within the signals to make sure they've got the right electrical stimulation going on for the nerves.
Which is a certain aspect of that is unpleasant to experience.
Probably.
But
once they figure it out, people have told me their pain's gone. I mean, it's like gone. No pain at all. So it's a pretty amazing feat and highly technological.
Now that's of course the extreme good,
right?
And then there's other people with experiences that aren't ain't quite that, but it has that potential. So that's why I'm a big supporter of having it tried, and even if it doesn't get that good a result, oftentimes it's still wonderful.
Right.
The difference it can make. Okay, are we getting no calls?
No
calls. Check the phone again.
No calls.
We're checking the phones. Okay, nobody is Skyping in, but that's okay.
Somebody's husband has a bad headache. Now, I would tell you, a bad headache, see your doctor, please.
Yeah, bad.
Yeah, if it's really bad, go see your doctor, because bad things can happen with a bad headache.
People can have a bad headache, and that's their normal.
And that can be their normal. But if this is your worst headache you've ever had...
Yeah, that's different.
Yeah, see a doctor.
Yeah, because we're worried about bad things, like bleeds.
Like a bleed in the brain.
Infections and...
Yeah. Especially, if you've tried like your home remedies and it's not getting better.
Yeah.
Your Tylenol.
Speaking of such things, usually it's migraine when we're talking about the regular bad headache. And I thought I was going to have an ocular migraine.
Oh, those are miserable.
Friday night because of exposure. No, Friday night? Yeah, Friday night because of exposure to strobe lights.
Nice. Did you go to like cancer? Or to
a cancer.
To a concert.
Saw the sign with the warning about strobe lights, and
you're gonna have
a
migraine or a seizure, one of those things.
I might be having those zigzag lines, zebra stripe lines, and loss of vision. Thankfully, without a headache, but it never happened. So I was glad it didn't happen.
Yeah, that could be miserable.
But I had a blast. I got to see Gary Newman in San Francisco Friday night, and wow, that was a great concert. Now, I had earplugs in. James did
Yes,
too.
protecting his ears.
Yes, we did.
Yes, so you don't come in and
James
have
was
all
the
those
youngest
high
person I saw in
frequency.
that place. Everybody was around from when Gary Newman was
Younger.
had hits like Cars. And,
Is that the 70s? Is that when that came
early
out?
80s.
Early
anyway.
80s.
Yeah. And our audience probably doesn't even know who he is. Doesn't have anything to do with medicine. Sorry.
I didn't know who he was. I had to. He had to show me.
Cannot come up with a Gary Newman song that has anything to do with health or anatomy. Sorry, can't even think of something here. No, can't connect it to the show at all. So,
let's see here. So, Rio says that sounds excellent for pain. I think she's talking about the
absolutely.
the implant.
Can we come up with popular songs that do have something to do with anatomy or health or a medical topic?
Or a medical topic. I'm sure we can. Now you're putting me on the spot, so
I really am.
We'll present it to the audience. Come up with a
Love Bites?
Love Bites.
Nah. I got a fever. And the only prescription.
That's not the song.
Oh, that's not the song. I'm sorry. What is the song?
100.
Don't fear the Reaper. No, that's suicide. That's a topic we've talked about before.
Gosh, yeah.
Yeah. So we're kind of anti. Who sings that? Blue Oyster Cult. I guess we're kind of anti-Blue Oyster Cult there.
Fever by Adele. Doesn't she sing a song?
Fever.
Or Fever by who's the?
Fever.
She's done.
Fever.
Fever when you hold. She doesn't sing that song. Who sings that song? I don't know. Anyways, we're getting a little off topic.
You mean Keith?
He sang that song, huh? Cry Me a River.
Crimea River is not a body of water in the Ukraine.
Yeah.
Because Russia has it now. The Crimea River.
Oh man. Anyways, we still have viewers.
Forgive our geopolitical humor that is not very timely.
Oh my goodness. All right, so
we're laughing. We do this for us.
Let's see. Elizabeth Morrison said she has a typical cycle where she gets seasonal allergies and then a chest infection, and she's an asthmatic. Do you have any preventive advice? Nasal saline.
I was going to say nasal steroid.
That too, yeah.
Nasal steroids,
as long as you don't get the nosebleeds. Antihistamines.
Astelin, the mast cell stabilizer, I believe is what it is. Oh, and even though it's called Astelin,
you use it in your nose.
Use in your nose. Even though it's not called Nosetelin, you spray it in your nose. Even though it's called Astelin. So, for those patients who had to be told that very...
Yep. And analgesics are by mouth.
They don't have to be. Oral analgesics are, but...
Oral analgesics.
Yeah, okay.
Anyways.
Just thinking that one through a little bit. Yes, and suppositories.
Oh, and
You're
get the flu vaccine. Bria
off.
says that she said the docs are sidetracked. She's answering her for us.
She's answering her question.
Yeah, make sure you get your flu.
Who's that? Is that Bianca?
No, it's Brio answering Elizabeth's question about preventive advice.
Brio, I'll just step in here.
Thank you. Yeah.
This is Brio. I'll be stepping in
for
the.
Yeah, I'll be answering all your questions
distracted doctors talking about, and I'll say it.
Let's see.
You're supposed to take the foil off the suppository.
Not sure what it's called over there. Take the foil off. Yes.
Because that hurts when it comes out.
Oh, man.
Every one of our jokes is based on a real experience.
Yeah.
What was the first thing I said to you this morning after I saw the first patient with the...
You said, I didn't think 30 minutes ago I would be squatting looking at what you were looking at with a flashlight.
I was using an otoscope, the little thing we use to look in ears. It has magnification and light, which is really good for looking at skin lesions. Well, these skin lesions happen to be on a part of a person's body that I just did not imagine I would be this close to with my face, especially since we think the diagnosis was scabies. So,
scabies. Oh, man. Oh, that's not a fun one.
That's like the first time I've seen it in this office. We don't see that here.
We-
Now, of course,
yeah.
Rena from Texas said, "Oh yeah, I see lots of it."
It's all the time. That's
Now,
for
not
sure.
that there's more in Texas than there is in California. I don't mean to make some kind of a statewide
right.
comment.
Don't write us letters.
There. It happens to be the type of office or teaching
Sure.
institution that she worked in, where
Yeah.
just like when we worked in teaching institutions, we saw more things like scabies.
Scabies.
And the reason, okay, and for those of you who actually are in medicine and know, you don't have to magnify scabies to diagnose it. You're right. I'm getting old. I like to get magnification and good lighting.
I don't need.
You do it from across the...
Stay back.
From
Yeah,
across
you got scabies. Doctor, why are you not even entering the room?
Yes, I do wear gloves for that. I don't wear gloves for
good.
earwax removal,
Yeah.
but for that I wear gloves. For those people who comment, he's not wearing gloves and earwax removal. Oh, you know what? We actually have, I'll address this. We have had people comment on videos when I'm not wearing gloves, doing an earwax removal, about needing to wear gloves every time you touch a patient. I had an attending who taught that.
Some do.
Before we even did our clinical rotations in third year, we had a guy at the VA who would actually put on gloves anytime he touched a patient.
I had a pediatric attending who was like that, and I think he literally had OCD. Like I'm pretty sure of it, but he would like double glove.
Just to do an exam on a
Just
patient?
to do an exam. Wear like 2 gloves.
Now here's the reason I don't do that. If there was some kind of a risk of transmission of disease, well, like I do glove up for contact precautions. Like
Sure.
if you had
If anybody's sick, and you're going to touch them.
MRSA or I guess any staff really, or
Yeah.
you know, there's certain things that we have precautions on. When patients are in the hospital with those, you'll put a sign on the door and say contact precautions. You glove up and gown up. But if it's not something infectious, I do not put on gloves before touching a human being. We work on people, not cars. And it's different. You can wear gloves when you work on cars, and it makes no difference at all to the car. But a human being needs to be touched, and appropriately. Some people do inappropriately, ruin it for the rest of us. But
therapeutic effect to
there is
skin-on-skin contact.
It is good, even if I'm not doing anything that involves physical examination, taking care of the patient. It's good just to get the stethoscope and take a breath, I don't even need to hear what their lung sounds are, but there's touch involved, and that is something that people who aren't medical practitioners but do some kind of a alternative medicine thing, that's one of the things they have on us is they listen to people.
Well, sometimes they don't even touch you with Reiki.
Is that what it's called, where they just wave their hands
that's how
over?
They pronounce it, Reiki.
They spend time.
Yeah.
They listen, and they touch.
And they have a therapeutic touch.
Yeah.
Yeah.
So there's value to
they do
touch.
Have us beat there.
And
we wash our hands.
I can't imagine what it would be. Yeah.
Before and after a patient. I do it.
Or hand sanitizer. Yeah.
Yeah, I do use hand sanitizer.
I found
so it's not like I'm introducing anything or getting anything.
And I found that if I use hand sanitizer, I
you get it
if
done.
If I washed my
washing
hands and dried them,
it takes too long.
Reality is, you could have a practice where you do that every time. You could. There may be a person who does that, but there are certain practical barriers involved with the time that keep it from happening. So it's just plain reality that we use the hand sanitizer, unless you actually see something on your hand or touch something you can see, then you wash. But if it's not visible, So there's something to be said for human touch. If I was a patient and somebody gloved up before examining me, it would.
I'd feel like
insulted.
I'll
just say it that way.
Yeah.
So no, I don't wear gloves every time I examine a patient.
I don't have that for any of my patients.
Hey, it's been long.
Yeah.
I'm sorry. So even though nobody called in, and we got off track, but we filled up an entire half hour. So thank you for joining us.
Yes, thank you.
I've got 20 people.
People had some other questions, but I guess we'll have to have another one of these.
Yeah,
question and answer
I labeled
times.
it for October, so maybe we could do it another month.
Oh, hey, maybe once a month we'll have a.
That might be good. Yeah,
and then otherwise we can have some other topics.
We want people to be subscribed to
drgreenknight.com. Go check it out. Like I said, the one this morning was on cells and the scientist's prayer book for that. last week was actually on video games. I really enjoyed writing that one.
James read it.
Did he enjoy that?
Talked about it over the weekend.
Yeah, I thought I went into it saying, okay, I'm going to do this research, and it's just going to show that video games are horrible for people. But the research surprised me, and it actually has some benefits. So check it out, drgreenknight.com, front page, video games. Check that one out. And subscribe while you're
actually need to comment on this. It was No Film School. Their podcast had some data from video games finding that the video game players, the people who played more than, I think it was like 5 to 10 hours a week, were more likely to have a higher income and
Interesting.
more likely to be married or something like this. And the guy came to the conclusion.
I bet the married part probably has an upper end of like how much you can play.
Anyway, it gave this impression that, oh, hey, the video game crowd is a little different in that it actually is not just kids.
Yeah,
it's
30-year-olds are doing it now.
With good jobs. And so their
not always, but
their
yes.
conclusion was, oh, well, video games are kind of like a good thing because they're associated with doing better, being better off, instead of what I think is the actual thing that's going on. I think they're confusing causation with correlation.
Correlation, yeah.
And I think what's actually going on is that people who have the better jobs can afford to play the games and spend more time doing it. And that if the people who weren't as wealthy could, they'd be playing the games too, but they're not able to because they don't have the time because they're having to work more or have other things that keep them from being able to. So I don't think that they are right in that
I don't know
playing video games makes people successful in other areas.
No.
I think it was the opposite. So I need to tell them. Anyway.
Yeah.
Thoughts on Dr. Gawain's blog from
check it out. Give me your thoughts.
And be subscribed to this. And if you want to be able to call in, you want to find the Patreon, the Dr. Vaughn Patreon, which there's a link in the description of this video. Until next time.
I'm Dr. Gawain Vaughn.
And Dr. Mark Vaughn telling you to stay in good health.